We know that heart disease and hardening of the arteries, or atherosclerosis, is the leading cause of death worldwide. It's actually been surpassed somewhat by cancer, unfortunately, although I think that speaks to the great prevention work we're doing, and not just our clinic, but how the whole world is doing to reduce risk factors. And people really know a lot more about risk factors these days, and it's actually not all that complicated to prevent heart disease, I don't think, as I'll tell you. But this disease, atherosclerosis, presents as heart attacks or stroke or peripheral vascular disease, where you have reduced blood flow to the legs. And this still, you have to develop something in your life, and but this disease affects a lot of people in the prime of their life as well. People with inherited cholesterol disorders who have other inherited risk factors, and cuts them down and gives them chronic illness even as young people. So there's still a lot of work to do to prevent this, and it's also a huge economic burden to our healthcare system. But the good news is that we really know most of the causes of heart disease, and there's most of the things that cause it are preventable, such as diabetes, high blood pressure, being overweight or having obesity, lung disease, and these are risk factors. And if you work on preventing heart disease, you actually reduce the risk of most other chronic illnesses. This is something I try to emphasize in a prevention clinic, that if you reduce the risk factors for heart disease, you're also reducing the risk of getting diabetes, high blood pressure, obesity, lung disease. If you stop smoking, you reduce chronic lung disease, lung cancer. If you prevent diabetes and hypertension, you prevent kidney disease. You prevent people needing to go on to dialysis. You prevent them from getting arthritis, from being overweight, and you prevent many forms of cancers. So putting efforts into prevention really pays itself back in preventing chronic disease and death. The things you can't do much about that are risk factors for heart disease and atherosclerosis are aging. Just getting older is a risk factor for hardening of the arteries. Men tend to have more heart disease than women until women go through menopause. You can't change your family history or your ethnic origin, and you can't change the fact if you've already had a heart attack or a stroke. When is family history important? We consider a parent or a sibling having evidence of heart disease before the age of 60. So if your mother or father or one of your siblings showed signs of heart disease or stroke or peripheral vascular disease before 60, that's a risk factor for you as well. And you don't have to have died from the heart attack before age 60, just started to show signs of it. Diabetes is also something that runs in families, adult onset diabetes. If one of your parents or siblings has it, you have about a 50% lifetime risk of getting it yourself. But the things that we can change are listed here, and these actually are responsible for most of the risk for heart disease. So the ratio of bad cholesterol over good cholesterol, or LDL over HDL, smoking, psychosocial stress, diabetes, high blood pressure, and abdominal obesity. So we hear a lot about cholesterol, and the LDL is the so-called bad cholesterol because it delivers cholesterol into the artery wall, and the HDL is thought to be the healthy cholesterol because it helps vacuum out and remove the excess cholesterol from the artery wall. And a lot of people still think that having high cholesterol is just your own fault. You just need to go away and be a better person. Eat healthier and exercise more. But about 1 in 40 people has inherited high cholesterol. And a way of knowing that you probably have an inherited component to your high cholesterol is if your total cholesterol is higher than about 6.5, or if your LDL is higher than about 4.5. And it's important to recognize when there's inherited high cholesterol in the family and in yourself, and then what can you do about it? And diet and exercise may not correct that inherited condition. Smoking is the second most predictive risk factor for developing hardening of the arteries. The chemicals in cigarette smoke cause your blood vessels to constrict, and they reduce the blood flow to the heart, the brain, all your tissues. And the chemicals in smoke damage the lining of your arteries so that the bad cholesterol can leak in more easily and get stuck in the artery wall. So as soon as you stop smoking, you reduce that damage to the artery wall, and the bad cholesterol can't leak in as easily. And the changes, the health benefits of quitting smoking happen almost immediately. And after about 2 years of quitting, we no longer count it as a risk factor if you've stayed quit. Stress is a hard thing to quantitate. You know, we all have stress. Stress is good to keep us moving, but if you're under chronic stress or depression, your body is increasing cortisol and adrenaline production, and that, through other chemicals that they turn on, cause damage to the artery wall as well. And in a very large study of people having their first heart attack, stress was actually the third strongest risk factor for having a heart attack after the LDL-HDL ratio and smoking. And people with diabetes have a higher risk of developing heart disease, about a 2 to 4-fold increased risk. And the reasons behind that we're not entirely clear on, but it includes changes in the cholesterol particles that occur with diabetes and increased hardening of the arteries. High blood pressure also damages the lining of the blood vessels and causes the artery walls to thicken, and also allows the LDL to leak in more easily. So we can reduce blood pressure by reducing salt intake. Exercise itself will lower your blood pressure, so will losing weight, and medication if you need that, and that definitely reduces the risk of death from heart attack and stroke. And abdominal obesity, shown in this very nice picture at the bottom here, is sort of gut fat. The fat that surrounds your intestines seems to be particularly harmful as compared to fat that deposits in other parts of your body. And there are inflammatory molecules that come from that fat that can increase the damage to the lining of the blood vessels. So you can be thin, but if you have abdominal obesity, you're at higher risk for heart disease. So I'll just conclude by saying that we really know most of the causes of heart disease, and we can prevent them. And it's actually not all that mysterious why people develop hardening of the arteries. And with more public education and prevention programs, I think we can make a huge dent in the incidence of heart disease, and particularly preventing chronic disease that occurs after you've had a heart attack, for example, and reducing it in midlife. So our Healthy Heart Program Prevention Clinic is a unique provincial resource, as Dr. Ignashevsky mentioned. We were called the Lipid Clinic before, but we morphed into this prevention clinic a few years ago. We're still the main site for referral of people with inherited lipid disorders in the province, but we assess all risk factors for heart disease. We're the biggest clinic of this kind in Canada. We have about 5,000 patient visits a year. And everybody talks about prevention, and St. Paul's Hospital is putting its money where its mouth is by supporting this prevention program. And at the moment, we are trying to develop an electronic database to really track our progress and help us do research. So that's one of our fundraising efforts right now.